this online university and especially Dr. Tariq for arranging a class on valvular heart disease. I think this should be a case-based approach and case-based evidence-based discussion on valvular heart disease. Today we'll discuss briefly on valvular heart disease, then we'll discuss separately on different types of valvular heart disease, especially common valvular heart disease like mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation, and so on. So let us start. This is the one of the case about a valvular heart disease. Like a 23 years old lady presented with shortness of breath on exertion, increasing intensity for the last several months. On examination, she is dyspneic, pulse 110 beats per minute, regular, blood pressure normal, respiratory rate around 30 beats per minute. There is a diastolic thrill in apex and first heart sound loud. Harmonic component of the second heart sound is also loud, and there is a mid-diastolic murmur in apical area, best heart in lateral position and breath hold in expiration. ECG showed sinus tachycardia, and on chest X-ray, PAV showing a stenting of the left border. There is a double right border. An echocardiogram showed there is a severe mitral stenosis with moderate pulmonary hypertension with Wilkins echo score that is 6. And the treatment that is given to the patient is the patient underwent PTMC and she is doing well. So what actually we have discussed the scenario of a case of mitral stenosis, that is the presentation of the case of mitral stenosis. So how a patient with mitral stenosis is usually presents. There is a usually shortness of breath on exertion, and it is gradually increasing day by day, and especially it is increasing on exertion, and it is increasing over the months also. So the commonest presentation of the valvular heart disease, as well as regurgitant type, or it may be stenotic type. So in both cases, the presentation is actually shortness of breath on exertion. So this is the commonest presentation. And there may be some other presentations like palpitations, chest discomfort, and so on, so on. And what are the examination findings? Actually, we take patient is usually dyspneic. And here we see that the patient is a young lady. There's a 23 years old lady. As you know that rheumatic heart disease is prevalent usually in the female. And there's a rheumatic, as a complication of the rheumatic fever, there's mitral stenosis. So it is also common in case of female. And mitral stenosis, especially as a complication of the rheumatic fever, mitral stenosis or mitral regurgitation, or that is mitral valvular heart disease, is also common in young patient and young female. So as a this patient is a young lady, and on examination, the findings actually we get, the patient is dyspneic, and patient may be sinus tachycardia, or even patient may have atrial fibrillation and fast ventricular rate. Actually, it depends on the duration of the mitral stenosis. If it is long duration, so there is a development of the enlargement of the left atrium that leads to the actually development of the atrial fibrillation also. So pulse is also here. This pulse is regular, blood pressure normal, respiratory rate a little bit increased, and there is a findings on picodem examination, that is diastolic thrill in apex, and first heart sound loud. We all know that there is a if there is a sinus rhythm, patient is sinus rhythm and mitral stenosis, first heart sound loud, and pulmonary component of the second heart is also loud due to the development of the pulmonary hypertension actually. And there is a main diastolic murmur in the apical area, best heart in the left valve position, breath hold in expiration. This is the typical presentation of a patient having mitral stenosis actually. This is the murmur, type of murmur, that is the mid-diastolic murmur, where actually it get in severe intensity or mostly found there is a apical area. And patient is the best heart in the left lateral position and breath hold in expiration. This is the typical presentation of a patient with mitral stenosis actually. On ECG, patient is sinus tachycardia. In some cases, patient may have atrial fibrillation with first ventricular rate, or there may be features of the right ventricular hypertrophy also. And there is a chest X-ray. Actually, what are the findings we will actually get in a chest X-ray view in a patient with mitral stenosis? There is a strengthening of the left border, usually found, and there is a double right border. This is the biventricular enlargement. There is enlargement of the left atrium actually, and that leads to the development of the double right border in the chest X-ray view. The echocardiogram, this is the gold standard investigation to diagnose in a case of mitral stenosis. This is not only gold standard for diagnosis of the mitral stenosis, it also gold standard and is a very good investigation tool to see the severity of the mitral stenosis and to see also the probability of the, as well as that is Wilkins echo scoring system, and from which actually we determine that this patient is in what treatment option is needed for this patient actually from the analysis of the Wilkins echo score. There is a Wilkins echo score is 6, and so patient is suitable for the PTMC. So patient under PTMC, that means Parkinson's transluminal mitral commissurotomy. It is a treatment option of severe mitral stenosis with patient having symptoms that are symptomatic severe mitral stenosis. There is a class 1 indication for PTMC, and after doing PTMC, patient is doing going well. Patient is significantly improved, and her shortness of breath is on exertion especially, and that is improved. So actually, this is the case and how actually a case of mitral stenosis usually present. What are the findings we can get with the mitral stenosis? What are the ECG findings? What are the chest X-ray findings? As well as what are the echocardiographic or color Doppler findings we can get from a patient with mitral stenosis? And what are the modalities of treatment we can offer to a patient with mitral stenosis? That actually depends on the severity of the mitral stenosis or the symptoms of the mitral stenosis as well. This is another case history, case report. That is a 53-year-old gentleman presented with shortness of breath on exertion for the last 2 years. Increasing in intensity for the last 3 months. This is another case. Here the patient is a male patient and is actually middle age or elderly patients, and his presentation is shortness of breath on exertion for the last 2 years, and this shortness of breath is increasing in intensity for the last 3 months. That is the increasing of the shortness of breath is increasing day by day. On examination, actually this he is dyspneic, pulse 128 beats per minute, irregular, blood pressure 100/30 millimeter mercury, respiratory 32 beats per minute. There's diastolic thrill in the apex, as well as there is a mid-diastolic murmur in apical area. And there is also early diastolic murmur in the left lower sternal area, and systolic murmur in the aortic area. ECG shows there is a atrial fibrillation. Chest X-ray shows there is a cardiomegaly. Echocardiography shows severe mitral stenosis with moderate aortic stenosis with severe aortic agitation with moderate pulmonary hypertension. So what are the treatment actually offered to this patient is the DVR, that is double valve replacement. And after doing the double valve replacement, this young gentleman is doing well. This gentleman is doing well actually. So what are the presentations here? That is the patient has double valve disease. As a double valve replacement has done, that is this is double valve pathology. That is there is pathology of the mitral valve, whereas there is the aortic valve. And in there is a mitral valve, there is severe mitral stenosis with moderate aortic stenosis and severe aortic regurgitation. That is here mitral valve pathology is stenotic lesion. There is severe mitral stenosis. And in these cases, there is aortic valve involvement, and this aortic valve has got both stenotic lesion as well as there is a regurgitation lesion. And due to long-standing mitral stenosis and aortic valvular disease, this patient also developed moderate pulmonary hypertension. And so the patient has got double valve replacement, that is here mitral valve as well as aortic valve is both are changed, that is both are replaced by metallic valve, and so after doing the double valve replacement, the patient is doing well. So actually discussion or what are the features we can get from this, or message we can get from this case report. There is a patient with double valve disease, that is mitral stenosis or mitral regurgitation or aortic stenosis, aortic regurgitation. Usually the commonest presentation of the valvular heart disease is shortness of breath on exertion. And usually it is increasing day by day. And on exertion findings, the patient is dyspneic, pulse is 120 beats per minute, and irregular, that means patient may have atrial fibrillation, and there is a mid-diastolic murmur, and it is due to a mitral stenosis, and there is early diastolic murmur in left lower sternal area, it is due to aortic regurgitation, and the systolic murmur in the aortic area, it is actually due to aortic valvular disease, that is aortic stenosis. So ECG shows atrial fibrillation, chest X-ray shows there is a cardiomegaly. This is due to actually double valve pathology due to mitral stenosis. We usually get there is usually no cardiomegaly present. The cardiac size is normal in case of pure mitral stenosis. But if there is associated with mitral stenosis or mitral regurgitation, the cardiac shadow may be enlarged. But what there is the involvement of the aortic valve, also there is the aortic stenosis or aortic regurgitation. Also there is a cardiomegaly, that is a cardiac shadow is enlarged. And echocardiogram shows there is a severe mitral stenosis. So what are the treatment modalities here? There is a double valve replacement. In the first cases, we have seen that the modality of treatment was PTMC, that is percutaneous transluminal mitral commissurotomy. That is an interventional procedure, that is not surgical procedure. But here we see that there is a double valve replacement, that is there is a surgical procedure or done to replace the both disease valves actually. So this is the actually another case, that is a 53 years old lady presented with shortness of breath on exertion for the last 8 months, increased intensity for the last 1.5 months. She had history of CMC 20 years, but CMC means closed mitral commutation. This is another surgical procedure to enlarge the stenotic mitral valve or the narrowed mitral valve. There is also a history of PTMC 10 years back. And examination, this patient is dyspneic, pulse 118 beats per minute, irregular, that patient is in atrial fibrillation, blood pressure is a little bit low, that is 90 or over 70 mm mercury, respiratory 32 beats per minute, that is a diastolic thrill in the apex, first transient is soft, that is patient may have actually not only mitral stenosis, patient may have also mitral regurgitation. There is a mid-diastolic murmur in the apical area based on the left lateral position, breath holding expiration, and there is a pansystolic murmur in the apical area with radiation to the axilla. There is a typical murmur that we actually found in a case of mitral regurgitation. There is a pansystolic murmur in the mitral area, and usually that radiates to the axilla actually. And ECG shows atrial fibrillation. Chest X-ray shows there is a cardiomegaly, that is there is a enlargement of the cardiac shadow, as well as there is a extending of the left border. There is a double right border also present due to mitral stenosis. And echocardiogram just confirm the severe mitral stenosis with severe mitral regurgitation with severe pulmonary hypertension with Wilkins ECO score 13. There is a Wilkins ECO score is 13, so the patient is not suitable for any interventional procedure. So the patient should send for mitral valve replacement. So there is the MVR, that means mitral valve replacement, and this is the actually proper treatment of a case of mitral valve regurgitation. So, and after mitral valve replacement, the patient is doing well. So this is actually a case of a patient with valvular heart disease, especially mitral valvular heart disease, where there is a both type of pathology, that is stenotic type of lesion as well as there is a regurgitant type of lesion, both are present. And due to the presence of both lesions and both both lesions are severe in grade, so the patient is underwent mitral valve replacement. And this is the actually indicated options for a patient suffering from mitral valvular disease. with severe mitral stenosis and severe mitral regurgitation, as well as severe pulmonary hypertension. So now something we will discuss about the as a whole the valvular heart disease. Actually we have discussed 3 cases. One is pure mitral stenosis, another case is mitral stenosis with mitral regurgitation, and that underwent mitral valve replacement. Another case is double valve disease, that's a mitral valvular disease and aortic valvular disease, and that underwent ultimately double valve replacement. So now something about the valvular heart disease. There is a common discussion around the valvular heart disease. Valvular heart disease usually where the heart valves actually open and close, where the heart valve cannot open and close properly. This categories under the structural heart disease. So if the patient with valvular heart disease not treated properly or not treated in the proper time, if left untreated, severe valvular heart disease may lead to the congestive heart failure and premature cardiac death. Even patient may have death if not treated properly. So this is the actually flow chart. This is the here we see that there is 4 valves, like this, the aortic valve. This is the aortic valve. This is the pulmonary valve. This is the tricuspid valve. But this is the mitral valve. This is the mitral valve in between the left atrium and the left atrium and left ventricle. This is the right ventricle. This is the right atrium. So in between the right atrium, right ventricle, there is the tricuspid valve, and this is the pulmonary valve in between the pulmonary artery and the right ventricle. And in between the right ventricle aorta, there is a aortic valve actually. So there is a 4 valves here, and usually what types of valvular heart disease is usually common. Usually mitral valvular heart disease is common, and especially as a complication of the rheumatic heart disease, then the common of the aortic valve, or there is a mixed aortic and mitral valves are common. But in case of as a complication of the rheumatic heart disease, pulmonary valve involvement or tricuspid valve involvement is low in incidence actually. That is not common. But when considering the congenital heart disease, there is a pulmonary stenosis that is also common. There is aortic valve stenosis that may happen. Even tricuspid stenosis or tricuspid atresia may even occur in a patient with congenital heart disease, and that valvular heart disease may have. These are the 4 valves in cross-sectional area. This is a mitral valve, but bicuspid valve. There is a 2 cusps. There is a 3 cusps that are tricuspid valve, and there is a aortic valve here, and there is a pulmonary valve. So in front, that is the which valve is lies in front, that is the pulmonary valve lies, then the aortic valve, and then in the posterior behind there is a tricuspid valve and the mitral valve. So valvular disease, how actually valvular disease is usually occurs in a case of as a complication of the rheumatic heart disease. And we all know that it is a complication of the rheumatic heart disease. There is actually valvular thickening occur. There is the involvement of the chordae tendineae, and due to the thickening of the mitral valve, there is inflammation of the mitral valve leaflets. So there is a narrowing of the opening of the mitral valve, the different types of valves, especially mitral valve or tricuspid valve. So there is a stenotic type ablation, but in some cases there may also the regurgitation type ablation may occur if the valve damage is more. So there is a not proper cooptation occur. So there is a non-cooptation. So there is a regurgitation. There is a leaking of the blood, and this is a regurgitation type ablation. In some cases, we may get both regurgitation type ablation and stenotic type ablation. Both may happen in a patient in a valve. So here the structure of the actually mitral valve. This is the tricuspid or mitral valve. That is there is a leaflets. The anterior posterior leaflets. There is a chordae tendineae. There is a papillary muscles, and through the papillary muscles and chordae tendineae, usually valve leaflets are attached to the ventricular muscle wall actually. So these are the parts of the of a valve actually. As is the annulus, there is a common issue, there is a chordae tendineae, papillary muscle actually. So there is a, we see that there is a maybe valvular stenotic type of lesion, where there is a stenosis, there is a area valvular area reduction, and there may be the valvular regurgitation. There is a leaking of the valve actually, or there is a combined lesions, like there is maybe a stenotic lesion as well as regurgitation lesion. So what are the causes of this valvular heart disease? As already we have discussed, there may be rheumatic heart disease that is common, or there may be congenital heart disease. There may be infection like bacterial endocarditis can cause the valvular lesions, and there may be the heart attack if there is a myocardial infarction. There is a rupture of the papillary muscle or damage of the papillary muscle, and that leads to the usually a regurgitant type of lesion to the valve actually. Due to damage of the papillary muscles. And there may be weakening of the supportive structures of the heart if there is a cardiomyopathy, and in different types of heart disease, there is actually due to dilatation of the heart, there is maybe coaptation, or there may be more opening in between the valve leaflets. So there is a regurgitant type of lesion that is leaking, there may be leaking valves also actually. So on the basis of the duration of the dysfunction, patient may have acute and chronic valvular heart disease. So depending on the nature of the valvular dysfunction, a patient may have a stenosis or regurgitation lesion, and there may be degree of dysfunction. And depending on this NOIHA classification, that is severity of the shortness of breath, a patient may have, so according to the NOIHA classification, there may be 4 classifications due to cardiac dysfunction. Here we see that there is a stenotic lesion, that is narrowing of the valves. So there is a hindrance, or there is obstruction of flow from the one chamber to the next chamber. And there or maybe also regurgitant type of lesion, that is leaking of the blood. That is when ventricle contracts and the blood should go from ventricle to the aorta or through the pulmonary artery, but also due to leaking, there's blood actually also regurgitation, and from the ventricle to the atrium also. That is called regurgitation. That may also happen. So there may be mitral stenosis or mitral regurgitation, a stenotic type of or a regurgitation type of lesion in the mitral valve. So there may be the aortic stenosis as well as aortic regurgitation that may occur in the aortic valve. There may be tricuspid stenosis or tricuspid regurgitation that may happen in the tricuspid valve. And in case of pulmonary valve, there may be involvement that leads to the stenotic or regurgitant lesions. So actually, what are the common investigations that actually we do to diagnose or to see the severity of the valvular heart disease? At first, we usually should take the history, and we should do the physical examination and the investigations like ECG, chest X-ray, echocardiography, and some other invasive evaluation like angiogram may needed in some cases, or there may be CT heart or MRI of the heart may be needed to confirm the some pathologies also, especially in the congenital heart disease. And there is already we have discussed that the cause of valvular heart disease is congenital heart disease, bicuspid aortic valve, especially it is common. There may be ischemic heart disease that may lead to the valvular heart disease. There is a rheumatic fever, there is a hypertrophic cardiomyopathy, or there is aortic disease like Marfan syndrome or Ehlers-Danlos syndrome that can lead to the valvular heart disease. So what are the common features that usually a patient may present when he or she have valvular heart disease? Actually, patient may present with symptoms of heart failure and low cardiac output. Patient may have breathlessness, patient may have chest discomfort, patient may have syncope, patient may have fatigue, and patient may have peripheral pulmonary edema due to heart failure. Even patient may have palpitation. So these are the features that can present in a patient with valvular heart disease. So an examination, usually we get some murmurs. Already I have discussed what are the murmurs actually we get in mitral stenosis or mitral regurgitation, aortic stenosis or aortic regurgitation. So there may be, when there is heart failure, patient may have bilateral crackles or bilateral edema, patient may have peripheral edema also, and bilateral basal case may have in a patient with heart failure with valvular heart disease. Even patient may have elevated jugular venous pressure, and if there is a cardiomegaly, in that cases apex may be shifted. So in ECG, echocardiography, and X-ray, actually we get different types of findings in different types of valvular heart disease actually. So these are the investigation, invasive evaluation, CT, MRI. This actually may needed to diagnose the different type of valvular heart disease actually. So I think we can stop here today. This is actually all about the general aspects of valvular heart disease. Next, in the next 3 or 4 class, we may discuss about the different types of valvular heart disease like mitral stenosis, mitral regurgitation, aortic stenosis, and regurgitation. Those are the very common in our daily day-to-day practice, or they are very common in our hospital settings also. So I think we can stop here today, and in the next class we can inshallah discuss about the mitral stenosis. Thank you very much. Genesis sir, আমরা আজকে ক্লাস শেষ করি এখানে। Thank you Genesis Online University.